Greetings to all our listeners. My name is Sulaimon Akanmu, the Professor of Hematology and Transfusion Medicine at the Lagos University Teaching Hospital and the Chairman of the National Task Team on Antiviral Therapy. I'm here with my colleague, Professor Uche Agbaji, a nephrologist from University of Jos. We are here to come and review with you and give you an update on some of the important topics that came up at the last IAS meeting in Brisbane, Australia. We will be going through these important topics one after the other. The first topic we would like to be discussing with you has to do with microbicide and prevention strategies to ensure that the female population are not that much exposed to becoming infected by HIV and AIDS again. Professor Agbaji, may I just ask you briefly, we say that the HIV epidemics is more or less a female epidemic. And there's actually an important reason why we say that. More females are actually more infected than the males. And the preventive measures in the female has to be prioritized. What do we have in our country, Nigeria? Do we have any idea of what are the preventive efforts, that is their mean, towards preventing infections among the females?
Thank you very much, Prof, for that question. Truly, HIV is a female epidemic, and for obvious reasons, the anatomy of the female genital tract, and some of the things we have available to protect female clients. We have issues, things like the female condom. We also have spermicides. We also have microbicides. And so those are things that we have, and they are available for use right now.
But in Nigeria, it's like experience is very weak, and we really do not have data whether Nigerian females actually have access to microbicides. And it would be nice to look at what is happening elsewhere and what the data is talking to us elsewhere in Africa. Particularly regarding the information that came out at the last IAS meeting in Brisbane. One important thing that came up is the availability now of the product that is called Dapivirine. Dapivirine has now been formulated as a microbicide and has actually been found to be very effective in prevention of HIV infection among female population. And the data are out there. There are quite a number of studies that I would like to share with us and share with our audience to bring home the point that today prevention effort among the female can be better improved than what we now have. We have the use of Dapivirine. Dapivirine actually is an NRTI drug that is known to be very lipid soluble, so can easily be formulated in a gel form and can actually be prepared in a way that it can be inserted into the vagina, into the anus, as can be useful in the vagina. It can equally also be useful in the anus. But the experience that we have so far has to do with its very its use, in the female vagina. The international partnerships on microbicide actually have formulated the Dapivirine into a silicone ring, 25 milligram, that has been described as a slow release. That if it is inserted there in the vagina, the good thing about it is that it stays there for the next 1 month, and you really don't have to have a reinsertion. So studies have been conducted mostly in southern African countries, in Zimbabwe, in South Africa, in Malawi, and a few other East African countries, to show that the use of Dapivirine as a vaginal ring is not inferior to the use of drugs, particularly CDF, 3TC kind of a drug, as a preventive measure in individuals that are at risk of becoming HIV infected. If we see this, the first one that you can look at the study that is called the Aspire trial, otherwise referred to as MTN-020 trial. In that particular trial, which was a phase 3 randomized placebo-controlled trial, more than 1,500 women were actually enrolled into that trial, and all of them were given Dapivirine vaginal ring, and it was found to be especially very useful. And the effectiveness in Dapivirine vaginal ring in preventing infection among this group of women was compared with another group of women of equal size to show that these other people were taking the drug daily. The other women were just inserting the ring every month. The ease of insertion was compared with the need to have to be taking the drug daily. And at the end of the day, which group has reduction in risk of infection compared with the other? So those who are taking drug as preventive measures and those who are taking the Dapivirine vaginal ring as preventive measures, there was no difference at all. The same trial was actually conducted again, what they call the MTN-020 025 trial, or the HOPE trial. In the HOPE trial, what was actually done in the HOPE trial was to show whether, in fact, the use of Dapivirine ring is preferable by the women compared with the use of drugs as a preventive measures. So in the HOPE trial, what they did was to show that the follow-up of patients was easier when they were on Dapivirine ring. The follow-up of patients was a little bit more difficult, that the retention in care was a bit more difficult when they are on oral drug. So it is a lot easier that we project and we support the use of Dapivirine ring as a preventive measures among our women. But the most important data that we now have concerning the use of Dapivirine ring is the information that came from Zimbabwe. In Zimbabwe, what they did was to enroll large number of adolescent girls and young women. And they focus on this group of people because the prevalence of HIV infection among this group of women was quite high. About 54% of 5 out of every 10 girls in Zimbabwe are HIV infected. And as you can see, that the rest of the population of the rest of that particular stratum of the population really need to be protected. And one good thing about the use of Dapivirine ring in this group of people is that it is more discreet. You don't have to be coming to the hospital. If you are living with your parents, you don't have to see what you are doing with yourself in your toilet. And that is why they decided to study what will be the acceptability of the use of Dapivirine ring in young adults who are at risk of HIV infection. And what they found when they did this study was that because it was both a quantitative and qualitative study, in the sense that they had an opportunity of sitting down with some of these women and asking them a lot of questions. In order not to waste some of our time, the essential finding here was that the girls that were taking the Dapivirine ring as preventive measures compare with the girls that were taking oral tablet as preventive measures. The dropout, as was shown in the HOPE and ASPIRE trial, was exactly what was shown in the Zimbabwe trial, meaning that when girls are allowed to use Dapivirine ring, they tend to comply more, they tend to adhere to therapy, and the data that I'm going to show to you next, we actually prove that. The essential point we are going to raise here is that the girl is in charge of his own health. If you are taking the tablet, you are at a risk of being, why are you always taking this tablet? The downside of the use of the Dapivirine ring, however, is the capacity of the girl to be able to insert the ring by herself. That was actually a major factor that led to its initial unlikeness by the girls. But after some time, as the trial was progressing, the girls were trained to be able to insert the thing. And you are going to see it in the data that's going to start. We are going to show you. So in this slide, you will see what was shown here. At the beginning of the slide, we had the very first month of the slide, you will see that what you see in the red there is that the service provider is helping them to insert the vaginal ring. But as the time goes by, the need for the service provider to be inserting the thing became unnecessary. Many girls are now able to insert the ring by themselves. That is one good point about that. And the other thing that I want you to bring to show us in this slide is that when girls are kept on drugs, the adherence is very poor. So they are more likely to become HIV infected. But when they are kept on vaginal ring, they are able to insert the ring themselves. It is more discreet for them to do it by themselves. And of course, when we now compare the risk of HIV infection in the two groups, we find out that those that are using Dapivirine vaginal ring are better protected than those that are kept on the oral use of TDF3TC, primarily because there is a lack of adherence to therapy. I hope we have been able to share some information with our audience. But the most important thing here is we really want to bring the import of this review data to impact on our national treatment program. As you are being contracted by NASCAP, developing updating our national treatment guideline. What do you think will be the take-home point here? As we are looking forward to reviewing the national treatment guideline with respect to prevention of HIV among young girls in particular.
Thank you very much for this update. And what we will be doing and what we are recommending is that Dapivirine vaginal ring will be a top priority to be one of the new comers in the treatment guideline update. And we hope that it will be one of the options for prevention of HIV among women in the guidelines as we review it. Thank you very much.
Thank you, Professor Agbaji. Looking forward to the updates in the National Treatment Guideline as we are starting to review it this January.